Now it's time for health, and we are discussing burns management and classifications. Dr. Olatubi Olawale, a physiotherapist with specialty in sport medicine and orthopedics, is our guest this month. Today, it's great to have you, Doc.
Thank you.
You're welcome.
Thank you very much.
All right, so we're talking burns. When last did I suffer a burn? I think it was hot water I was trying to boil, and I had to pour the hot water, but I think I was too fast. Slipped on me. Well, the first thing I rushed to was a tap because that was the closest thing to me. But that is me trying at home and all of that. Let's hear professionally. Let's talk about burns, classifications, because that burn from hot water is not the same as burn from fire.
Yeah.
It's not the same as maybe touching a pot and all that. They are different and all that.
Yeah.
Let's classify them. How do you classify burns?
Yeah. Burns is actually a damage to the skin by fire, hot water, chemical, frostbite, ionizing radiation.
Frostbite, so that means cold can even give burns.
Yes.
Ah.
And it affects the skin. And you know, the skin is the largest organ of the body.
Organ of the body, yes.
And the skin, we classify the skin into 3 parts.
Okay.
We have the epidermis.
Epidermis,
this is
okay.
what we're seeing
Skin.
here.
Okay.
Then beneath the epidermis, you have the dermis.
Okay.
Then we have the subcutaneous tissue that's inside the dermis. That's the dermis, epidermis, dermis, and the subcutaneous.
And the subcutaneous tissue.
So those 3 layers actually forms the skin.
Okay.
So burns can actually be caused by, I said it earlier on, chemical, frostbite, hot fire, flames. Sun can actually cause burns.
Yeah, sunburn.
Sunburn.
Very, very, very popular. People talk about it. I mean, that's why the sunscreens are selling so much and all of that.
And it's been classified into 4 levels. Four.
Okay.
You have the first-degree burns. The first-degree burn actually affects the epidermis, just the surface of the skin. You just see redness of the skin. Most of the time, there is no blister.
Okay.
Then the second degree affects the epidermis and the dermis. Then we have the third degree. The third degree affects the epidermis, the dermis, even affects the subcutaneous tissue.
Okay.
That's getting deeper. Now we have the 4th degree burns. The 4th degree burns, that's the most severe one, which affects the epidermis, the dermis, the subcutaneous tissues, and even affects the muscles and bone inside. So those are the major classifications for burns.
Okay, so 1st degree, 2nd degree, 3rd
degree,
and 4th
degree.
So let's go with healthcare, first aid. With these different levels of burns, what is the first thing to do? If you are not a professional, at home, office, accident, this happened, what's the first step to go? Palm oil, honey, water. People do a lot of things.
Yeah. The first thing to do is first stop the burning process. What is causing that burn? Stop it first. Then the next thing, you put the patient inside on a running water. Just
running water?
Run at room temperature. Running water, just running tap. I said the other time when you had the burn, you put your hand on the tap. Yeah. That's the best thing. Running water. Then also, do not apply oil on the patient's body.
That's what a lot of people do,
at that
and they still do now.
Do not apply oil.
Why not?
Because sometimes this petroleum gel or some Vaseline can actually cause more heat to the body at that time. So, but when the body is cool, you can now, when the doctor have checked and everything, you can now check, okay, you can apply anything you want to apply. But at that moment, do not apply any oil on the body. Then don't use ice. Some people try to use ice on a burn surface. Ice can actually even cause the burn. So other thing I used to tell people again, then do not break your blisters. When there's blister, don't try to break the blisters.
Allow it
to go.
So you know, yeah, because of I'm somebody that, look, when I have a small cut on my body and then the dermis starts forming or the hard skin cover, I always like to peel it off and all of that. And people tend to have sort of that kind of in quotes, a fetish or something of peeling off, you know, the body or the burns or wounds and all of that in that way.
That's not a very good way to manage burns.
Okay.
Burns, one thing about burns is that burns will heal on itself. There's a healing process for burns depending on the severity of the burns. And they used to calculate burns based on body percentage. That's another classification. You'd hear 35-degree burns, 50-degree burns. They classify based on, there's something we call rule of 9.
Okay.
They divide all the bodies into 9%. 9%. Upper body is 9%, lower body 9%,
okay.
My legs 9%, 9%, 9%. So depending on the total area of the body, it now tell you that, okay, this is 50% bone, 75% bone. And I tell people when there is bones on the joints, because joints, when there is bones on the joint, it can cause contractures. Contractures in the sense that there can be stiffness of that joint if there is no proper management. Some people manage their bones because they say, I don't want to move it, let it be like that. When there is healing, there is contraction of the joint. So where physiotherapy comes in now is that we move the joint, all the joint, there should be continuous range of movement on the joint to avoid contractures and stiffness of the joint.
Stiffness of the joint after a burn.
After a burn injury.
So, you know, now when all of this, now we've mentioned first aid, how do you transport somebody who has suffered a burn, depending on, it may be a severe burn, third degree or something?
Thank you.
How do you transport?
Thank you for that, because I should have said that earlier, because after the first aid, the next thing, transport to the hospital. Because and transportation is based on the severity anyways. If it's a first degree burn, it's something that, okay, can actually be managed at home or something. But if it's second degree, third degree, which is affecting deeper tissues, transport. And when you're transporting, you just wrap the patient with a clean cloth or sheet. Not a dirty cloth now, because remove all the burnt clothes, wrap the patient with a clean cloth and transport. Because when you wrap it, we don't wrap with a clean cloth, there might be infection. Infection can come into because the wounds are actually open. So it's open to any kind of infection.
Wow, and how should so if say the burn is not a total burn, how do you place the patient if say we want to put the person, it's not so easy to get an ambulance. So let's say you're transporting the person in a car. Do you understand? How do you place such a person?
The placement, when you are transporting, the placement of a patient is based on where the affected part of the body. If the back is still fair, it's still okay, you can just lie the patient down. And if the front is affected, assuming it's the back that is affected, the patient will be on lying face down. So just make sure that the patient is comfortable enough till you get to the hospital. Now, when you get to the hospital now, the doctors or the nurses, they know the proper positioning to position the patient to avoid contractures and stiffness of the joint.
Okay. Now, if, say, around the house, not so many people have first aid around, what kind of first aid can one have in such situations, apart from water? What should be in the first aid that can aid? Is there any other thing that can aid?
The first thing is just running water.
Just running water?
When you have a burn, just put your hand in the running water. Let it cool down, for at least from 10 to 15 minutes. It shouldn't be too much. At least 10, depending on the severity of the burn, 10 to 15
Yes,
minutes.
and then when we talk about burns and fires, I know that oxygen is when fires are into somewhere, you said something about stopping the cause of the fire and all of that. If it's around the person, People have, they've debated this over years. Do you roll the person? Do you carry cloth over the person if there's still fire on the person's body? If it's that serious, how do you react in that situation?
The best thing is that after stopping the burning process and there's still flames, because flames actually can still cause.
I know, okay, but how do you stop this burning process in the best way, not to aggravate or not to cause more harm to the person?
The patient have to roll.
The fire is still on the person.
Roll on the floor. Roll on the floor, or use a blanket or something to wrap the patient. But the best thing is rolling on the floor. When you roll, you'll be able to kill any fire or flames around on the body.
Okay, and that's a great way to stop.
And some people pour water, like they just pour water on them and everything, just to when there's no tap, when there's no running water, they pour water. But I tell people that don't pour cold water. Don't use for ice. Just normal room temperature, just to stop the eating process.
Thank you very much. It was a pleasure talking to you, and I hope this is something people can always make reference to and get tips from.
Thank you very much,
Doctor.